Hi, my name is Sheila. This is my video submission of a respiratory assessment of an adult male client.
Come in.
Hi, Mr. Johnson. My name is Sheila. I'll be your nurse today. I'll be doing your respiratory assessment. Will that be okay?
Yes, ma'am.
Okay, we'll start with some basic questions, and then I'll proceed to doing your exam of your front and your back of your chest. Any questions?
No, ma'am.
Okay. First question would be, have you experienced any coughing, either gradual or sudden, late at night or during the day?
No, ma'am.
Have you had any shortness of breath or any periods of difficulty breathing?
No, ma'am.
Do you take any medications for breathing?
No, ma'am.
Okay. Have you experienced any respiratory infections like asthma, pneumonia, or any severe cold in the past 6 months to a year?
No, ma'am.
Okay, how about family history of respiratory breathing problems like bronchitis, asthma? Do you have anybody in your family?
No, ma'am. This is not going to end well. Don't start.
Do you have a couple more questions, Mr. Johnson? Just a couple more, okay? Do you smoke cigarettes or cigars?
No.
Is there anyone in your home that smoke?
No.
Okay. Do you work in any conditions that may affect your breathing, like outside or anything?
No, ma'am.
Okay. How about a family member who has been in prison, incarcerated, or have you visited anyone in prison?
Ask me all these questions. No.
Okay. Well, just one more question, and that's about the flu vaccine. Do you normally have your flu vaccine taken yearly?
Yes, ma'am.
Okay. All right. So now that we're done with all the questions, and I'm sorry about that, sometimes it can be long, we're going to proceed with doing the physical part of the exam. I'll have you go ahead and take off your shirt while I go to wash my hands, okay?
Okay.
I'm going to wash my hands. Okay, Mr. Johnson, I'm going to start by taking a look at your hand, please, sir. I've already washed my hands. So I'm just assessing for the color of your hands. Make sure there's no discolorations. There's no sweating. That can tell us some signs of respiratory distress. There's no cyanosis. Right now I'm just going to tap over your nail bed, just searching for capillary refill, which it returns in less than 2 seconds. So it means you're getting good circulation through your blood vessels. I'm going to go ahead and take your pulse here. So get my watch right, okay? Just assessing your pulse. And I'm going to count for a whole minute. Okay, your pulse is 78. Now I'm going to go ahead and take your blood pressure, sir. I'm going to pretend like I'm putting on a blood pressure cuff.
Why would you say that on camera?
So you know.
Okay.
Blood pressure cuff is on. I'm just going to go up under and I'm just going to listen. My hands are a little cold. Go ahead and relax for me. Now I'm just going to listen. Okay. Blood pressure 110. Okay. So now I'm going to take a look in your eyes, and I'm just assessing, for color. Open your eyes. Okay. You'll look up for me, and I'm just going to look under the lids. Okay. I'm just assessing for anemia. Your eyes aren't pallid. Good pink color. That's good. I'm going to have you open your mouth for me. Stick out your tongue. Lift up. Okay. Very good. I'm just going to take a look at your throat here. Okay, have you look over to my right, which is your left. Okay, back over this way. Okay, so now we're going to proceed to do examination of the chest. We're going to start with palpation, and I'm just going to palpate, gently palpate, and you can look straight at me. And I'm just going to tell me if there's any tenderness. Indian pulse. Okay, so just finished palpating his chest, and there's no signs of tenderness. Looked at your neck. Your trachea is midline. There's no JVP distinction. So now, okay, Mr. Johnson, let me have you sit straight up for me because I just want to take a look. Yeah, just face me. I just want to take a look at your chest and just make sure that it's even, symmetrical. I see no discoloration, no lesions. I'm going to step over to the side here. Just look at the front to the back. There's a 1 to 2 AP diameter. So that's just what we want. That's what we expect. And I've already assessed for tenderness, so there's no tenderness there. Okay. Okay, next I'm going to palpate for chest expansion. I'm going to put my thumb midline at the lower this rib cage. Sorry, my hands may be cold. And I'm going to just ask you to breathe in and out for me. Take a deep breath in. In. Okay. And you notice my thumb do expand about 5 centimeters apart. So that is what we want to see for equal chest wall expansion. That's good. Now we're going to do tactile firmness. Okay, and next I'm going to do the tactile firmness like I said. So I'm going to have you say 99, and I'm just going to be listening or feeling for symmetrical vibrations on both your right and left side. Go ahead. 99.
99. 99. 99. 99.
Okay, and then over here.
99. 99. 99.
Okay, so next I'm going to proceed to doing percussion. On this part, I want you to lie back at a 45-degree angle, okay? Okay, so we're going to proceed with the deep percussion to listen for the deep renaissance sound. You hear that? That's what we're going to be listening for. So I'm going to start up here above your clavicle. It kind of gets dull as I'm going across the chest wall. Okay, I'm going to do the same thing over on this side. Dull sound there, which is what we want. Go up under your arm. Okay. Okay, and then next now we're going to proceed to auscultating your lung sounds. Okay, and I'm going to proceed now to auscultate all lung fields. Starting up here at the top, number 1. Take a deep breath for me, please, sir. Okay, I'm going to proceed to do the posterior. I can have you face that way, sir. Deep breath for me, please. I've just completed auscultating all anterior and posterior lung fields. Now we will proceed to do one last thing here, and that's I'm just going to percuss and just looking for... Okay, I apologize for my hands being cold, but I'm just going to Go ahead and feel, and I'm just assessing for symmetry. There's no lesions here. There's no discoloration. Also, while the patient is sitting straight up and I'm looking from the back, I can also note any spinal deformities such as scoliosis, and there's none noted here. There's a smooth, even in. One last thing, I'm going to have you breathe in and out for me. Again, I'm going to do the same thing when I was assessing for chest symmetry. I'm just going to look in your back. Go ahead, take a deep breath for me. One more time. Okay, that's fine. Thank you very much, sir. Okay, so I've done palpating and auscultating, both anterior and posterior. There were no adventitious breath sounds found. There were the bronchial-vesicular breath sounds found over the bronchial trees, and vesicular breath sound found all other areas of the lung fields. The last thing I'm going to do is I'm going to percuss again the posterior. I'm going to start up here. Okay. Okay, Mr. Johnson, I can have you swing back around this to the front, please, sir. Okay. This will conclude my respiratory assessment for adult male client. Mr. Johnson, do you have any questions for me?
No, ma'am. Good job.
Okay. Thank you very much, and thank you for watching Sheila's video assessment of a respiratory assessment of an adult male client. Thank you.